Hello, very good evening. Today I am going to discuss on very important topic, abnormal uterine bleeding. This topic is very much important point of view because it's very common nowadays and 30% of gynecological 30% of all female they suffer from this problem. So when we can say this is abnormal uterine bleeding. First I will tell you about what is normal uterine bleeding. There is three important thing which you have to keep in your mind. First thing is cyclic interval. Normal cycle is 28 days cycle as everyone knows. If your cycle is between 28 to 35 days, that is also considered as a normal cycle. So nothing to worry if your cycle is in between 21 to 35 days. Second important thing, menstrual flow. So how many days your flow? 4 to 5 days bleeding is normal. It's considered as a normal. Third important thing, menstrual blood loss. How much blood loss you can say this is the normal. Normally 25 to 80 ml blood loss during period is considered as a normal. So nothing to worry if you having bleeding between 20 to 80 ml, it is absolutely normal. Any uterine changes, like any uterine bleeding outside of the normal volume, normal duration, regularity is considered as abnormal uterine bleeding. So let's come on. What is exact etiology behind that? What what is the reason behind that? Why abnormal uterine bleeding can occur? What would be the reason? It can occur in the any ages, in any reproductive ages. It can be. It can also occur in 25-year age, 30-year age, and but more common in premenopausal age. Like between 40 to 45, it is quite common. So normally uterine bleeding, like 80%, it's uterine origin. Uterine origin means it could be from uterine origin. 20% another system would be involved, like liver. If you have any problem in the liver, so what we say, always uterine abnormal uterine bleeding is not always related to your uterine pathology. Sometime also it related to your another systematic organ like liver. If you having some problem in the liver since long standing, it can be. Another, if you have any blood related disorder like leukemia, thrombocytopenia. Thrombocytopenia means less platelet count. It can be the reason for abnormal uterine bleeding. And also hormonal causes. Hormones also, you can say it is main culprit for this. If you have hypothyroidism, it's quite common. If you have hyperthyroidism, then it is really things to worry. Normally, hypothyroidism is quite common in women as compared to hypothyroidism. Now we can discuss on uterine uterine causes, which is involved 80% for the uterine reason. One could be reason polyp. If you have polyp in uterus, polyp means a small muscular like protruding, like pimples kind of thing in the uterus. That also can give abnormal uterine bleeding. Another thing, adenomyosis. Third thing, leiomyoma. If you have leiomyoma on your uterus, leiomyoma can occur anywhere. If you have in the uterus, it can increase the density and diameter of the uterine wall. So normally we can say fibroid. Another thing, if you have malignancy, it could be the reason, it could be malignancy as well. Malignancy, if you have cervical cancer, that is one of the most scary reason. Another thing, if you have endometrial carcinoma, and another third infective reason, if you have tuberculosis, endometrial tuberculosis, which is also common in quite region like Jammu and some another tropical cities and country. It's quite common. So, gynecologist point of view, doctor point of view, first we should rule out what is the reason behind that, why you have abnormal bleeding. It could be polyp also, as I said. It could be hormonal reason also, like hypothyroidism, hyperthyroidism. It could be because of liver failure also. If suppose you have history of chronic drinking or hepatitis, it could be reason. So first, rule out why this is, why this is coming. And nowadays, stress also can be reason for abnormal uterine bleeding. So what we should do? Patient point of view, if you are facing with this problem, abnormal uterine bleeding, as I have clearly told you, three things to be noticed. One is cycle, another is menstrual flow, third thing is menstrual blood loss. Apart from this three, apart from this three, you have to focus on another thing also. If your uterine blood, if your period blood is coming in clot, it is smaller or bigger, if it is coming in the clot. Another thing, number of thick sanitary pad, how many numbers of pad you are changing per day. If you are changing more than 4 or 5, then it's really one thing you have to discuss your problem with your gynecologist. Another thing, another, what could be the reason for the predisposing factor for this? If you are using some pill means any hormonal pills, that could be also reason, which is estrogen containing. Another thing, if you have any device in your uterine cavity, device in the sense, if you have copper T in your uterine cavity, that could be also reason for abnormal uterine bleeding, but that is very common and nothing to worry for that region. Another thing, as a doctor, what we should do, what we should rule out. First thing in mind, first we should rule out what is exact reason is behind, what is, predisposing factor for this, from where it is originating, whether it is originating from your uterine cavity itself or whether it is originating from another systematic organ, as I told you, like liver, like blood vessels, blood clotting disorder, or something bleeding disorder like hemophilia or von Willebrand's disorder. First thing is, we should rule out from normal USG. What is exactly in the uterus? Whether it is a polyps, whether it is a leiomyoma, whether it is a adenomyosis, or whether it is a endometriosis. Roughly, we can get idea from this USG ultrasound. You have two way for the ultrasound. Either you can go for the transabdominal, which probe will be kept over on your abdominal wall. Another thing is transvaginal ultrasound, which is very much informative compared to transabdominal ultrasound. But the thing is, in India, we have most of them male. Radiologist, and many female they don't prefer male radiologist, so this is quite difficulty for them. And what and the another thing is, what is the difference between transvaginal and transabdominal ultrasound? If you are obese and your abdomen anterior abdomen wall is thicker, so it's quite difficulty to focus on your internal organ and it will be little hazy. So we prefer TBS, transvaginal ultrasonography route, so which will more informative and non-invasive procedure. Another thing, we need to rule out whether you are anemic or not. If you have abnormal uterine bleeding like menorrhagia since long time, since more than 4, 5 or 6 months, there is a chances of decreasing hemoglobin. If hemoglobin is decreasing, there is chances of decreasing your kidney function, heart capacity, everything. Another thing we should rule out, if uh, treatment is based on your age and another thing on your symptoms. If your age is almost near 40 or between 40 to 45, we must need to rule out cervical cancer and endometrial cancer. Roughly, we can get this idea from ultrasound only. We can see the thickness of endometrial wall, ET thickness. Endometrium is nothing but inner layer of the uterus. If it is too thick, we can suspect endometrial carcinoma. Cervical carcinoma also we can roughly detect from ultrasound. Apart from this, we advise pap smear and DNA HPV test to rule out cervical cancer. Now comes to the treatment point. Many women in society they are more worried and they are like really hesitant to come near doctor. Exactly why exactly the thing is, the complete idea is behind why they are scared, why they are not ready to come near doctor, because they are very keen to discuss this problem with their neighbor, with their elder sister, and with their relative, and with their grandmother. And they will start giving their new ideas. They say, "No, don't go near the doctor." They will give you either some device like copper T like device. Normally, we put Marina. Marina is nothing but it is a device look like a copper T, but it doesn't contain copper. It is LNG. Another thing, they will also tell you this thing. If you are going near doctor, they will operate it. An operation will be risky. No, we don't operate for all menorrhagia case and for all abnormal uterine bleeding case. There are two treatment, one medical line treatment and the one surgical line treatment. Based on symptom and based on the diagnosis and based on the point of the diagnosis only we can decide what is ideal for you. If your bleeding is more but your hemoglobin level is normal and your age is between 40 to 45, we start from some hormonal pills. Even after giving pills, if your blood if your bleeding is not getting control, we can suggest you for LNG. We can suggest not LNG, we can suggest you for this Marina. Another thing, if you are not an ideal candidate for the Marina insertion, there is another way for hysterectomy. We can do hysterectomy also, but nowadays we prefer hysterectomy only in few selected case. Few selected case in the sense, your when your family like completed your age is the early 45, 42 year, there is no point of keeping uterus inside. There is no point of keeping home. If you have really too much excessive bleeding and you have endometrial thickness is more, there is no point. Another thing, we have also few another facilities like laparoscopic facilities. We can do transcervical resection, also endometrial resection we can do through intracervical route without opening your abdomen. We can do endometrial ablation as well. Not always surgical treatment would be surgical removal of uterus. Not always. It's depend on your doctor. Also, it's depend on your financial status, and also it's depend on your symptoms. If you have any family history of cervical uterine or some another cancer, then we must suggest go for hysterectomy. And in case if you having leiomyoma, big fibroid, we ideally suggest hysterectomy if your age is nearly 48.